Hi, my name is Maria Dziubinski and I am a nursing student at the University of Michigan. Today I am going to be presenting a patient to you. My patient is a 53-year-old Caucasian female who is divorced and has 2 kids. The patient works as a lab manager at the University of Michigan. The patient receives care from her primary care physician. The patient's vitals were all in normal limits. Her temperature was 98.6 degrees Fahrenheit, her blood pressure was 120/62, her respiratory rate was 16 breaths per minute, and her heart rate was 66 beats per minute. Chief complaint. The patient's chief complaint is loss of feeling in the hand and right arm due to shoulder popping out of socket and the inability to pop it back in. The patient started having pain 3 days ago and numbness began to occur, so she decided to come in. The patient tore her labrum 5 years ago and the doctors at the U of M anchored it back down with 3 screws. After she tore her labrum, her shoulder would often dislocate on its own. It never hurt until 3 days ago when it popped out and the patient could not pop it back in. This led to loss of feeling in the right arm and hand. The patient rates the pain at a 7 out of 10. The patient said the pain is interfering with daily activities as she started to feel numbness. The patient usually lifts weights 2 to 3 times a week and goes running 4 to 5 times a week. The patient claims she attempted popping her shoulder back in without success. The patient has taken Advil to try to relieve the pain. When that didn't work, the patient sought medical attention. Health history. The patient reports no history of childhood illness. The patient reports she is currently diagnosed with depression and was diagnosed 3 years ago when she got a divorce with her husband. The patient is all up to date on immunizations. The patient reports no allergies to any food, drugs, or latex. The patient reports no recent hospitalizations. The patient reports hospitalization when she received knee surgery at the age of 42 and again for her labrum surgery at the age of 48. The patient currently takes Celexa for her depression. She takes 20 milligrams orally once a day. The patient also reports taking Advil when she has headache pain or pain in her shoulder. Functional assessment. The patient admits to drinking 1 to 2 beers a night with dinner. The patient admits to smoking marijuana about 3 times a week. The patient admits to a past history of smoking cigarettes. She stopped when she was pregnant but picked it back up and now she smokes 1 pack every 2 weeks. The patient exercises 5 to 7 days a week. The patient drinks coffee every day. The patient has a healthy diet. The patient says she only gets about 5 to 7 hours of sleep a night. The patient has good interpersonal relationship with her family and friends. Psychosocial data. The patient claims she has a good family dynamic and lives with her 2 children. The patient claims to date men but is currently not in a relationship. The patient reports her divorce is a huge stressor in her life. She also reports that she is currently moving out of her house and that is a stressor as well. The patient has a master's degree in biology. The patient is not religious. The patient reports no environmental hazards in her life. Family history. The patient's mother has skin cancer and is diagnosed with depression. Her father has COPD and emphysema. He uses a small ventilator. Her father has always had lung problems due to smoking 1 pack a day. The patient states her maternal grandmother has had depression and also had skin cancer and died at 88. The patient reports that her maternal grandfather and her paternal grandmother died from old age. The patient reports that her paternal grandfather died at 82 due to a heart attack. The patient states that both of her sisters are alive and healthy. Review of system. The patient claims she generally feels healthy with herself. Her divorce has taken quite a toll on her happiness, but with the love and support of her family, she is able to maintain a happy outlook on her life. Neurological system. I decided that due to the patient's current state of depression and family history of depression that it was important to assess the neurological system. Upon examination, the patient seemed antsy and easily irritated with a short temper. The patient received a 29 out of 30 on the mini mental state exam. She knew where she was and what the date was. The patient's registration and short-term memory was normal. The patient's attention and calculation was normal and she could count backwards by 7s easily. The patient forgot one of the items on the long-term memory test, which I believe is due to easy distraction and aging. The patient's language tests were normal and her level of consciousness was rated as alert. The patient's motor function was normal. She had a smooth, nice, equal gait and balanced well when walking heel to toe. She had no swaying when we performed the Romberg test. Her upper extremity motor function was normal with the 3 techniques tested: finger to nose, examiner's finger to nose, and rapid alternating hand movement. The patient could also perform lower extremity heel to shin tests with no problems. The patient's sensory function was normal as well. The patient knew where I was touching during light touch and painful touch sensation bilaterally. The patient felt the tuning fork on her elbows for vibratory sensation. When I tested striganosis, the patient knew which object was in each hand. When I tested graphophagia, the patient knew what I wrote on each hand. When I tested proprioception, the patient knew where her body was in relation to space. The patient also demonstrated pathological reflexes normally. When I performed the Dziubinski test, her toes contracted in, and when I performed ankle clonus, there was no jerking movements. I also decided to assess the musculoskeletal system due to pain and injury in the right shoulder and past labrum surgery. It is important to assess this system to make sure there are no abnormalities or difficulty with healing. She states her range of motion in her right shoulder feels very limited due to the current numbness and pain. She reports no swelling or burning in the shoulder when doing intense physical activity. The patient does not have any weakness of the joints. The patient has no history of arthritis. The patient reports sometimes using ice on the shoulder. The patient's body is even bilaterally in muscle mass and bone structure. The patient has a nice erect posture and smooth, even gait with arms swinging bilaterally on both sides. The patient does not have any scoliosis or signs of scoliosis. When palpating the joints, the patient has no arrhythmia, inflammation, warmth, pain, or crepitus in any of the joints besides some pain in the shoulder, specifically the right one. The patient appears to have full range of motion in all joints besides the shoulder, specifically when the patient tries to flex and abduct her shoulder. All other range of motion tests appeared normal for the patient. The muscle strength was a 5+ on the deltoids, biceps, triceps, wrists, fingers, hip, hamstrings, quadriceps, and ankles. Pertinent system number 1, integumentary system. I decided that the integumentary system was pertinent. It is important to assess the system due to a family history of skin cancer, specifically melanoma. Melanoma is a skin cancer that develops in the melanocytes. It can be more serious than other forms of skin cancer because it may spread to other parts of the body and cause serious illness or death. When checking for melanoma, it is important to observe all moles on the patient's body. The first symptom of melanoma is usually the appearance of a new spot or change in an existing freckle or mole. The change may be in size, shape, color, and is normally noticed over several weeks or months. According to the Journal of National Cancer Institute, it is important to perform skin self-examinations as they are associated with a reduced risk of melanoma incidence, especially if the melanoma is common in your family. Studies were shown that skin self-examinations may provide useful and inexpensive screening method to reduce the incidence of melanoma. Skin self-examinations may also reduce the development of advanced disease. Pertinent system number 2, respiratory system. I also decided that the respiratory assessment was necessary due to a family history and functional assessment. Because the patient's father developed COPD and has emphysema, and because the patient smokes a pack of cigarettes every 2 weeks and also smokes marijuana, I thought it was important to perform a respiratory assessment. Smoking is the main risk factor. Nicotine is a potent addictive alkaloid inhaled when smoking tobacco and reaches the nervous system within a few seconds, stimulating nicotinic receptors. The patient is a current cigarette smoker, so this could put her at a greater risk of developing it. The journal also stated that COPD does have a genetic factor. Although neither one of the patient's sisters have this disease, it is important to keep an eye out due to her father's current condition. That concludes our assessment. These are my references.